Hey everyone, greetings from Dr. Prepper. I hope everyone is staying indoors and staying safe from this new wave of COVID that has hit our country. And while we are indoors, let's take a look at some more concepts and some more questions that might come for your NEET. Solving these questions is what is going to give you the edge to do well in your NEET. So let's go get you that PG seat and let's look at today's topic. So the topic for today that I want to cover is the partograph. So why I don't have a question for you today like I usually do is because the whole partograph in itself is a question. Any section of it can be a question, and it often gets confusing. So let's look into it and how to answer the various questions that can come from the partograph. So the partograph is actually the one that we use here, and the one that is followed is actually the WHO partograph. So the partograph is basically a tool that was designed to monitor all aspects of labor. So it is divided into different sections to provide a full assessment of labor when a lady is undergoing labor, when she's in the latent phase and active phase. So it's divided into three phases. The first one is the fetal condition, second one is the progress of labor, and the third one is the maternal condition. So now we're going to look at what the partograph is and its different components. So this is what the full partograph looks like. So it's actually a little confusing and too big. So what I'm going to do is I'm going to break it into sections for you to understand. But like I spoke about, there are three phases. This is the fetal part. This is the progress of labor part. Progress of labor. And this is the maternal condition part. So dividing it into these sections actually helps us to understand the partograph, and I'm going to try and break it into as small sections to help you really understand how to go about understanding this partograph. So let's start with the first section, which is actually the fetal condition part. So it has your basic name, so the gravida pair, as we talked about, the gravida scoring. So the G score and the P score has to be written here, the hospital number of the patient, some basic details, whether the membranes are ruptured, at what time. So the most important parameter to measure here is actually the fetal heart rate, which is tracked along this graph. So any bradycardia that you notice, if you suddenly notice, the normal fetal heart rate is about 120 to 160. It's here. So if you suddenly notice that the fetal heart rate is continuously staying below 120, going down to 100, that's fetal bradycardia. So tracking this actually helps to know whether an emergency LSCS is needed as an intervention. The next thing I want to look at is amniotic fluid. So that is basically, if the membranes are still intact, it is written as I. If the membranes are ruptured and it is clear, it is denoted by the letter C. If it is meconium stained, it is M. If it is blood stained, it is B. So that is what you chart in this amniotic fluid section. So now molding. So what is molding? Molding is basically when the bones of the fetal skull actually, when they start entering the pelvis and start engaging, they start overlapping with each other. So when you do a PV, the obstetrician is actually supposed to feel for the fetal head and see if molding has occurred or has it started, where the bones are overlapping. So some people like to grade it where it is either absent or it is either 1+, 2+, or 3+, based on whether there's some molding or severe molding. But usually people like to document it as present or absent. So it's either absent or it's present. So those are the things we look at for the fetal condition part of the partograph. So now we will look at what I feel is one of the most important parts of the partograph, which is the progress of labor. So in this with time and the number of hours from when the labor goes into latent phase or active phase, the two things are plotted on this. So if you look at the top half from number 4, that is where it starts. So when the cervix reaches a dilatation of 4 centimeters, that is when you start plotting the partograph. And the ideal rate of progress of dilatation of cervix is 1 centimeter per hour. So if you notice, if every hour it goes up by 1 centimeter, this line is plotted, which is the alert line. So a normal progression of labor, which you don't have to worry about, usually stays in this section of the partograph. It will stay to the left of the alert line. If by any chance, let's say you got a first plot here, the second plot here, and the next plot you notice that the cervical dilatation has not progressed. So once you've moved to the right of the alert line, you need to be very alert. The lady needs to be in a hospital, she needs to be on a constant CTG trace, and she needs to be monitored regularly because we might require to intervene. If the plotting crosses the action line, that means definitely she requires some urgent intervention, or she needs to be evaluated as to why the labor is not progressing normally. So remember, normal labor is to the left of the alert line. Once you go to the right of the alert line, the lady needs to be on constant monitoring and you might have to intervene. Once it goes to the right of the action line, that means there is danger. So we definitely need to intervene. The second part of this partograph that is monitored is the descent of the head. So you would be puzzled to see why it's going from 4 to 0. So as you know, descent of the head is basically the position of the fetal skull in reference to the ischial spines. So this is basically the station of the head. So a station of +4 means it's obviously very high up into the abdomen, and 0 means it has a stage 2 means it's at the level of the ischial spines. Obviously stage 3 means it's between the abdomen and the level of the ischial spine, and stage 1 means it's across the ischial spine, and 0 is when you can feel that the head is fully engaged. So you plot descent along these lines in this part of the graph. So that is also helpful to see the progress of labor, and I will highlight on it later. So next let's look at contractions. So the next part of the partograph, but still within the parameters of progression of labor, is the contraction and the oxytocin. So oxytocin is basically just tracking how much units of oxytocin we are giving to the lady, which is used to augment labor, as we all know. So contractions are plotted based on the interns or the obstetricians are supposed to monitor the contractions. So you feel for the abdomen, you feel in the where the contractions are hardest, and you feel for a continuous period of 10 minutes. And in those 10 minutes, you have to track two things. One is the number of contractions. How many contractions were there in 10 minutes? The next thing you track is how long was each contraction. How long was the duration of each contraction? So how you plot this is what I'm going to explain in the next slide. So this is how contractions are depicted. So like I said, the contractions plot is divided into 5 boxes. So you need to know how many contractions. So that's where you plot here, the number of contractions. So if it's 1, you shade 1 box. So now how to decide how to depict the duration of contraction. So like I said, if the contraction duration was less than 20 seconds, you mark the box as a dotted pattern. That means each contraction was lasting only less than 20 seconds, and the number of boxes denote how many contractions are there in 10 minutes. If the contraction lasted 20 to 40 seconds, you have to stripe. That's how you depict it. And if the contraction lasted more than 40 seconds, you shade the box fully. Okay. So that is how you plot contractions. So in a very swift and in a very compact manner, you are able to very easily denote to anyone who knows how to read a partograph as to how many contractions are there and what is the duration of each contraction. So you might get questions where someone just gives you this plot and tells you to just the options will just be describing how many contractions and how much duration was each contraction, and you can be asked to select from one of those options. So now looking at this plot and remembering this key, I want you to just feed this key into your brains. So remembering this key will help you easily understand what this partograph plot means. So coming to the last bit of this partograph, which is the maternal condition. So there you are tracking any drugs that were given to the mother, what IV fluids she's on, her vital signs. So her pulse is denoted as each of this section is 1 hour. So half of this section is, so this is basically at half an hour. So at half an hour duration, you have to keep plotting her pulse. So her pulse is monitored with a dot. Then you monitor her BP with these arrows. So a BP of 140 by say 90 will be denoted like this. A BP of 120 by 80 will be denoted like this. So these are the ways where you monitor the mom's vitals. Her temperature is monitored. If she's having any fever, that means she might have choreamnionitis. So that is again an emergency which needs to be intervened immediately. And you also monitor her urine. So whether the urines are having any protein, any proteinuria, any ketone bodies, and how much urine she is putting out. Proteinuria basically is obviously indicative of eclampsia or pre-eclampsia, and therefore it's very important to track that. So this basically is just an overview of how to track the maternal condition during labor. So what is the point of knowing about the partograph and knowing how to plot it? So the two most common conditions that you need to diagnose by looking at a partograph is arrest of descent and arrest of dilatation. So I'm sure you would have heard of the term cephalopelvic disproportion before. A lot of people say it's CPD. This is when the fetal head, after engaging in the pelvis is not like geometrically, it's not built to accommodate the fetal head. Therefore, the fetal head will not descend, and therefore normal delivery is not possible. So this, if you diagnose early, and with the help of a partograph, you can actually diagnose this early on. It actually helps in early intervention and LSCS, because the biggest mistake that is made is that in a person with CPD, cephalopelvic disproportion, is starting oxytocin to augment labor. This will only cause complications because you're trying to push the fetus out of the birth canal, but however the fetal head cannot pass through the birth canal. So basically this causes a lot of fetal distress. Therefore this partograph helps us to diagnose CPD early, and we can have early intervention with an LSCS and not give oxytocin to augment the labor, thinking that the contractions are not adequate and that's why the head is not descending. So two very simple ways or two simple plots to diagnose arrest of descent. So first we're going to look at arrest of dilatation. So arrest of dilatation is basically also known as secondary arrest of dilatation. So this basically means, imagine you started plotting the partograph at 4. After 1 hour it's reached 5. After 1 hour it's reached 6. So the cervix is actually dilating adequately. But then suddenly you notice after 1 hour it stayed at 6. It's again stayed at 6. Then maybe it's gone to 7, but it is actually now delayed. So we've moved to the right of the alert line. So this is actually just right of the alert line, but if the cervix remains at the similar measurement and continues to be so after every hour, that is called as secondary arrest of dilatation. So that is very important to diagnose, which you can obviously very easily diagnose with a partograph, and then you can look at measures to or you can evaluate why the cervix is not dilating and intervene, whether she needs a stretch and sweep or whether she needs any other maneuvers to help dilate the cervix. That is very important to diagnose from here. So that is how you diagnose a secondary arrest of dilatation to ensure early intervention. So the next thing we look at is arrest of descent. So that again can be primary or secondary. So you start with the station at 4, which is above the ischial spines. So you can have a descent coming down to 3, coming down to 2, and then suddenly you realize after that, if you're plotting, the station is not coming down beyond 2. So that is what is secondary arrest of descent. So a lot of times you can get a partograph with just this plot, just this image, and they will be like, what is your diagnosis? So you know that this part of the partograph is the station of the head and that it plots the descent of the head. So now you know that the descent is staying at 2. So the station is not changing. That means the diagnosis of this partograph is arrest of descent. So that is what is important to know. Just knowing which part of the partograph is used to plot what can help you diagnose a lot of conditions and help you answer a lot of questions. That is very important to know.
That's all for today's topic. Please hit the like button if you like the video. Share this video so that other people like you can benefit, and subscribe to the channel if you want to continue seeing such videos. If you need any topics for me to cover, please let me know in the comments section. So keep up the good work and all the best for your NEET.